Hello everyone, I'm Dr. Nirmala Devi. I'm going to present topic of General Pharmacology, Lecture 1. So let's start. The history of pharmacology. How this field of pharmacology, which we see today is well flourished, has emerged. So the current trend of pharmacology started as a separate science in mid 19th century. And what were the practices before 19th century? From the ages, there were no scientific basis of cure because there were lack of experimentation, the knowledge of body systems and its functioning was unclear, and the people used to believe in magic remedies. Remedy and diseases were connected traditionally and believed that the diseases are caused by the because of the sin or the malpractices performed by the people, and the treated or the remedies were taken as magical. There were various religious rituals along with the use of product or parts from different plants, animals, earth, metals, or soil. They were continuously being explored for their healing properties. For example, at that time, concoctions from worms, dung, urine, or moss from a dead man's skull were explored for their healing properties. Simultaneously, India was also exploring and expanding in its vast knowledge of healings. Ayush is a very ancient, where Ayurveda, Unani, Siddha, and homeopathic practices, since ancient, they were practiced in India. Also, therapies were there, where acupressure or some type of massages were already there in those centuries. 15th and 16th century, there were simultaneous exploration in the field of life sciences like botany, zoology, biotechnological skills. These spheres were already developing simultaneously. As I mentioned, simultaneous developments or explorations in the field of life sciences were occurring at the time of 15th and 16th century. In that era, there were so many physiologists who were continuously working on relieving the sufferings of the people. They established their labs, continued exploring the medication remedies in the plants, animals, or minerals, and they started to observe the body conditions. The famous pioneers or the scientists or physiologists in that era has a long list. Some of the important one I'm going to show you in this slide. Claudius Galen, 129 200 AD. He continued the work of Hippocrates. As you know, Hippocrates is father of medicine. He contributed greatly to Greek medicine, and we know his 85 constituents. Then Paracelsus, he is called as grandfather of pharmacology and father of toxicology. Synthetic organic chemistry is born in 1828. Then Friedrich Wehler, chemistry born synthesized urea, synthetic chemistry born in 1828 when Friedrich Wehler synthesized urea from inorganic substances. So, in synthetic form of a medicinal source of medicines were first started by Friedrich Wehler. Then Francois Magendie is known for his animal experimental procedures, where drug testing first started by him. Jonathan Pereira, known author of Element of De Materia Medica, then J. Lagle, Henry Dale pioneered physiological approaches to pharmacology. I am only telling you the major contributions of these pioneers. You can go through one by one if you are interested in knowing the exhaustive history of pharmacology. You will come to know that these people were the foundation or pillars of the pharmacology uh, field which we see it today. They are behind it. To name some of the other, Oswald Smidberg, known as father of experimental pharmacology, he did PhD in 1866 with the topic of monitoring chloroform in blood, and he published his contributions in the journal. His contributions included discovery of effect of muscarine or heart as the electrical stimulation of vagus nerve in 1869. In 1878, he wrote the textbook of Outline of Pharmacology and discovered glucuronic acid. In 1885, he discovered urethane as hypnotic drug. Then Sir James Black is known as father of modern pharmacology. He received Nobel Prize for Medicine in 1988 for the development of propranolol and cimetidine. Claude Bernard, known as father of modern experimental pharmacology. Paul Ehrlich, known as father of modern chemotherapy. Louis Lasagna, known as father of clinical pharmacology, Hippocrates, as you know, father of modern medicine, Theophrastus, and Dioscorides. Together, they contributed a lot in exploring the plants as drug and compiled De Materia Medica, which has 5 volumes. It is a Greek encyclopedia of herbal medicines. On Dioscoride and Theophrastus, they are together known as father of pharmacognosy. Then Valerius Cordus compiled first Pharmacopoeia. Francois Magendie, father of modern pharmacology, he elucidated physiological processes and drug actions on the body. Experimentation practices to test the drugs were started by him. Claude Bernard, he found the site of action of curir. So he is father of experimental medicine. Then Friedrich Serturner isolated morphine from opium. Pierre Joseph Pelletier and Joseph by name Caventou, they both together isolated quinine from cinchona. Friedrich Banting, they uncovered the power of insulin. Albert Sass, streptomycin, which is the first aminoglycoside antibiotic. Ehrlich and Sahachiro Hata discovered salvarsan. Salvarsan is one of the milestone, and it is also known as magic bullet. It is used to treat sexually transmitted disease in males called as syphilis. So the list is still exhaustive. These are some of the important physiologists or chemists, I would say, or the pioneers who uh, led a foundation for the field of pharmacology. In India uh, and its neighborhood, Pensau Herbal Materia Medical in China, 2700 BC, Kahun Papyrus in 2000 BC, Egyptian compilation of veterinary medicine and uterine diseases of women, then Eber's Papyrus, Egyptian compilation of various diseases, and 829 prescriptions it carried. 829 remedies, it may be in the form of plants. Then in India, Vedas, ancient Vedas has a record of 3000 BC Rig Veda. Charak Samhita, which has more than 650 drugs, is known as father of Indian medicine. Sushruta is known as father of Indian surgery. Vagbhatta, Dhanvantri. These are some other names. No, Bhagavatta, Dhanvantri are our gods. Dhanvantri is physician of gods and he is father of Ayurveda. Ayurveda is linked with all the arts and practices related to improvement in the life of the people and increase the longevity by various yogic practices, various home remedies in the form of plants, products, and other remedies from the natural sources. Indian pharmacology modern form took shape in the leadership and under the observation of Colonel Ramnath Chopra. He is known as the father of Indian pharmacology. In 1921, he became the head of the department of Calcutta Medical College. In 1941-1957, he was director of Drug Research Lab, Srinagar. His contributions included the effect of Rauwolfia serpentina. He established the first National Drug Research Institute of India, Lucknow CDRI, and there he researched on indigenous and traditional medicines. Now, what is modern pharmacology? First, we have to understand what is pharmacology. The pharmacology is the study of source, physical and chemical properties, compounding, physiological actions, absorption, fate, and excretion of therapeutic uses, interaction of drugs, chemical compounds with various living organisms. So there are so many things included in the field of pharmacology. First, we have to know or identify or develop the source of drug. Then we have to study the physical and chemical properties, how to compound it in a form of medicine, then physiological actions, absorption of the drug when it is taken, how it works in the body, it's eliminated from the body, and then its therapeutic uses or its interaction from different parts or proteins in the body, chemical nature or chemistry of these compounds. Uh, so all these aspects are studied under pharmacology. This is the modern definition of pharmacology. Modern pharmacology took its shapes by development of pharmacopoeias, isolation of active ingredients, and animal experimentation to find the target or the site of action of the drug or the fate or passage of the drug in the body. The earliest version of pharmacists emerged with the rise of apothecaries in medieval Europe, which maintained quality control and medical advice to community. During late 1800s and early 1900s, discovery of specific molecular target and their structure to which the drug binds gained momentum. The mid 20th century, specifically 1940s and 1950s, is called as the golden age of antibiotics because tetracyclines were developed at that time. Later 20th century is preceded by the development of targeted drugs like monoclonal antibiotics. So now earlier we were knowing the effect of drug on the organisms, and then we studied its effects individually on different organs in the body, and now we are able to study or we are able to observe the effect of the drugs over the cell, and we now know, or we can manipulate the molecules through which the drug is binding to produce a certain effect. So this is the depth of the knowledge which we have reached so far, and which started in the mid of the 19th century. Some of the definitions is, pharmacology is the study of drugs. It is this word came from Greek words. Pharmakon means a drug or medicine. So drug is active ingredient which is actually having the effect, and medicine is its uh, complete, yeah, final form after adding excipients or adjuvants to the drug. And logos is to study or to gain the knowledge. So in pharmacology, as I have already mentioned, we study the origin, nature, chemistry, and the effect of drugs on organisms at the subcellular, cellular, organ, and systemic levels. It deals with relationship between chemical structure and biological activity, site of effect localization. It means where the effect is desired by the drug, fate of the drug in organism, how much drug will be excreted out, how much will be bound, or how much will be freely circulating in the blood, and how much drug will be available at the site of action. So this is the fate of drug in organism. Then in pharmacology, we evaluate the relationship between dose and biological effect so that we can understand what is the ideal dose for a different category of patient. Now, how do we define drug? Drug, any substance or product, natural, synthetic, or semi-synthetic, that is intended to be used for prevention, treatment, and diagnosis of disease or modification of the physiological system or pathological states for the benefit of the recipient. It is derived from the French word drogue, which means a dry herb. Now, medicines can be used for treatment or to heal or for medical remedies, or it can be for the recreational purposes, which is the non-medicinal use of the drugs. Most of the drugs earlier were discovered by serendipity or hit or trial method, but nowadays the drugs are invented through experimentation and optimization of many independent properties. Some other definitions include pharmacotherapeutics, which is the use of drug in curing diseases and relieving their symptoms. Pharmacokinetic is the study of kinesis or movement of the drug or interaction of the drug in the body, which is the time course of drug, also known as absorption, distribution, metabolism, and excretion of the drug. Overall, we can say that pharmacokinetics is the study of what the body does to the drug. Pharmacodynamics studies drug dynamics or power of the drugs or effect of the drug in the body. It includes biochemical and physiological effect of drug and their mechanism of action at subcellular and macrocellular levels, and along with duration of action. That is, we can say pharmacodynamics is the study of what the drug does to the body, all the types of effect, whether they are desired effect, that is the therapeutic, or they are toxic effects or adverse effects. All the effects provided by the drug to the body, we study under pharmacodynamics. Then pharmacogenetics. Pharmacogenetics is study of inherited traits related with the effect of drug. So these inherited traits produce polymorphism or ethnic variations. For example, we can say alcohol dehydrogenase and aldehyde dehydrogenase. These two enzymes are deficient commonly in Asian population, and so these people in these regions are less tolerant to alcohol. One another example is an acetyltransferase, and this enzyme varies according to latitude of the country. So ethnicity and its variation is studied under pharmacogenetics. Pharmacogenomics where the pharmacogenomics, which is the study of altered response based on genetic background. For example, we say glucose 6 phosphodiesterase deficiency is linked with hemolytic anemia. Clinical pharmacology, scientific study of drug in men, where patients and healthy volunteers are selected for testing of drug in their body. Chemotherapy deals with study of chemicals on the microorganisms and parasites. Toxicology is scientific study of drug in men, where drug or any chemical act as a poisonous thing, and we detect the poisonous level of that drug or chemical and how it is managed, what are the antidotes, development of antidotes. Now, what are the different sources? As I have mentioned, sources of drug can be natural, synthetic, or semi-synthetic. Naturally, the drug can be obtained from plants, animals, minerals, microorganisms, humans. There are a lot of examples known today from plants: atropine, digitalis, artesunate, quinine, morphine, vincristine, vilblastin, and there is a long list. Animal drugs include most of the hormones, proteins, or vitamins. For example, insulin, heparin, protamine, vitamin D, vitamin A, vitamin K, etc. Minerals included the drugs containing element complexes like ferrous sulfate, aluminium hydroxide, magnesium hydroxide, zinc, calcium, selenium, potassium, etc. Then human also is a source of some drugs or hormones like menotropin, HCG, urokinase, etc. Now, what is the scope of pharmacology? Pharmacology is still a emerging branch. There is a lot to discover, and there are new arenas being uncovered today in the field of pharmacology. So, pharmacologist has a lot or a huge scope. Some of the scope is listed here, like they are involved in screening of drug for desired active compound, in academics, in higher education institutions, member of healthcare team in hospitals and community pharmacy. They determine mode and mechanism of action. They quantify drug activity when chemical methods are not available. Development of models for testing the drug on animals or by in vitro methods or using the cell lines. Imparting preclinical data and imparting clinical data, arranging them, and analyzing them. They perform biological assays. They are intensively involved in research and development activities in the field of drug discovery, drug development, testing of the drug, and the diseases in the population, etc. Now we will study drug nomenclature or naming or taxonomy of drug. IUPAC, chemical name or structure-based name, named according to its chemical structure. Then generic name, they are non-proprietary, official names or approved names. For example, aspirin. Then proprietary name, also called as brand names, commercial or trade names. They are used for marketing and sales purposes. Drugs can also be classified based on their therapeutic action, pharmacological action, molecular action, and chemical nature of the drug. Over-the-counter drug, these are the drugs that can be dispensed without the prescription of registered medical practitioner. Then comes prescription drug, legend drugs, or prescription only medication. They are dispensed under the supervision of registered medical practitioner only. And these drugs bears the label caution. Then essential and non-essential drugs. So we see the World Health Organization, how it defined these drugs. Those drugs that satisfy the healthcare needs of majority of the population are essential drugs. Essential drugs should be available at all the times in adequate amounts and in appropriate dosage forms at the price the community can afford. All the listed drugs under essential drugs should be afforded by the community in that area. Non-essential drugs are other drugs which usually include the branded drugs and costlier drugs. Controlled drugs are the drugs which are always kept under lock and key. They are given by the physicians, not provided by the pharmacist. They are having the dependence or abuse liability, like most of the narcotic drugs, and some of the synthetic drugs or derived drugs from the narcotic drugs also have this tendency. The CNS drugs category, CNS stimulant, all and all. Fixed dose combination drugs, the drugs which a single drug which is having multiple active ingredients to provide simultaneously more than two or three types of benefits to the patient. Orphan drugs. Orphan drugs are the drugs which are used to treat rare to rarest diseases like tyrosinemia, Wilson's disease, Gaucher's and Fabry's disease, sickle cell anemia, cystic fibrosis, porphyria, some cases of methyl alcohol poisoning. So these are the drugs according to New Drug and Clinical Rules 2019. And orphan drugs treats a condition affecting not more than 5 lakh people in India. And according to WHO, it should be less than 6.5 to 10 per 10,000 people. So orphan drugs is required rarely because these diseases are rare or mostly they are inherited or mutation type of diseases. The expenses incurred during the development, manufacture, and marketing cannot be recovered from selling the drug by the pharmaceutical company. So, governments in different countries, like developed countries, offers tax benefit and other incentives to pharmaceutical companies for developing and marketing such drugs. For example, under Orphan Drug Act in USA. Other countries may have different act to support the manufacturing and marketing of orphan drugs. Now, what are the sources of drug information? Drug information should always be accumulated from authenticated and validated sources. For that, we can refer pharmacopoeias or formularies and different reference standard texts available. Pharmacopoeias like Indian Pharmacopoeia, United States Pharmacopoeia, British Pharmacopoeias, formulary, Pharmaceutical Codex by Pharmaceutical Society of Great Britain, National Formulary by American Pharmaceutical Association, then National Formulary of India. Some reference textbooks like AMA Drug Evaluation, Modern Drug Encyclopedia, Physician's Desk Reference, Martindale Extra Pharmacopoeia, etc. Now we see now as I have told you, there is a difference between drug and a medicine. Drug is actually the active ingredient, which we call as active pharmaceutical ingredient or raw material used to create drugs and pharmaceutical products. And medicines are the dosage forms. When we add excipients to the active pharmaceutical ingredients and make it in a certain form which will be convenient to administer in the patient is called as dosage form. Now, why there is a need for designing different dosage forms? And it is a separate field of pharmacy, which is called as pharmaceutical sciences. And nowadays, targeted drug delivery system is a recent trend where different dosage forms are designed to target the drug specifically to the site of action to avoid the wastage and to reduce the side effects. So why there are different dosage forms? Because they should be convenient to use or handle them or to store them. Dose accuracy should be there, protection from GIT contents, protection from the environment, and improvement in the palatability, delivery to the target site, desired release pattern of the drug, optimal drug action, insertion to the body cavities or orifice to improve the solubility and also to validate economically according to the communities or the affording rate of the community. Now, dosage forms can be gaseous, liquid, solid, semi-solid. In this flowchart, we can see different dosage forms and route of drug administration. Different routes of drug administration include oral route, parenteral route, sublingual, intrarespiratory, urethral, rectal, intranasal, vaginal, conjunctival, intraocular, transdermal. And against these routes, we can see different dosage forms. Now, why there are different routes of drug administration? Since dosage forms are different, different dosage forms are administered through different routes. So why there is different routes? The factors can be ease of administration, site of action, onset of action or emergency, how fast we want the action of the drug, duration of action, how long we want the action of the drug in the body, like it can be delayed, it can be controlled, it can be sustained, or it can be slow release. Then physicochemical properties of the drug, rates and extent of drug absorption or bioavailability, accuracy of dose acquired, patient condition, vomiting or comatose. So these are the different factors because of which we design different routes of drug administration. We will see one by one the advantages and disadvantages of different routes. Oral route. Oral route is very safe to administer. It is convenient. It is economical, easy to store, handle, and transport. Because oral route drugs are generally the solid dosage form. So they are easy to store, handle, and transport. But there are disadvantages of oral route. Oral route drug, when goes to the stomach, can be influenced by the hydrochloric acid and other gastric juices like penicillin, erythromycin, epinephrine. There can be influence of food on absorption. Some food can slow the absorption of the drug because of the increase or decrease of the intestinal motility, or the drugs can form the complexes with the food particles. So, because of their increase in size, absorption may be poor. Limited absorption can also be because of the first pass metabolism. First pass metabolism show the inactivation of mucous membrane enzymes of small intestine and liver, therefore entering the drug into the systemic circulation. Drugs in the stomach can initiate or trigger the ulcer condition in the body, like non-steroidal anti-inflammatory drugs, chlorpromazine, reserpine. Some of the drugs may be impossible to use inside, like resection of digestive organs, severe diseases that are accompanied by malabsorption syndrome. Some of the drugs are even contraindicated to peptic ulcer patient and gastritic patients. Also, in the person who are continuously vomiting and has drowsiness or dizziness condition and in the state of unconsciousness. So these are the important drawbacks of oral route. Then sublingual route. Sublingual route, in this we keep the dosage form or the medicine under the tongue behind the cheek. So absorption of the drug is incomplete and erratic. But what is the absorption advantage? Sublingual route bypass the first pass metabolism, bypass the destruction by stomach acids. Drug stability is maintained because saliva pH is relatively neutral and they provide immediate pharmacologic effect. Disadvantages include the limited dose which can be administered through this route, and some part of the drug may even be swallowed sometimes. Rectal route, its absorption pattern is erratic and variable, just like the sublingual route. Advantages are also like sublingual route. They bypass first pass metabolism, bypass destruction from the GI contents and stomach acid. They are ideal for vomiting and comatose patients. Disadvantages includes that these drugs can irritate the rectal mucosa and they are not well accepted. Rectally administered drugs should be in the form of suppositories or enemas, and volume administered should be 50 to 100 ml. Now, administration of drugs by injection route, which is called as parenteral route. There are different parenteral routes like subcutaneous, intramuscular, intradermal, intravenous. There are so many routes which is delivered through injection. So subcutaneous. Absorption pattern depends on drug diluent, aqueous solution prompt, and depot preparation slow and sustained. Important in emergency medical practice like injection of antidotes or during anesthesia and vaccination. The volume of solution is administered not more than 1 to 2 ml. Effect occurs within 15 to 20 minutes after injection. So it is for emergency condition and immediate action. Subcutaneous injection is workable. It is suitable for slow release drugs and ideal for some poorly soluble suspensions. Disadvantages: pain and necrosis can occur at injection site, and it is also unsuitable for large doses. As you can see, not more than 1 to 2 ml of the drug solution should be administered. Intramuscular. Intramuscular absorption in drugs which are administered through intramuscular route, absorption pattern depends on drug diluents, aqueous solution prompt, and depot preparation slow and sustained. Applied sterile isotonic aqueous or oily solution suspensions. This route of administration is less painful than an injection into the subcutaneous site. It gives effect in 10 to 15 minutes. The volume of injection should not exceed more than 10 ml. Absorption of the drug from muscle can be accelerated by applying the body warmer or conversely by slow down or using ice. So warming or body warmer can accelerate the absorption and icing can slow the absorption. Advantages include moderate drug volumes can be given. They are suitable for oily vehicles, preferable for intravenous administration if patient must self-administer. Then disadvantages, they affect certain lab tests, can be painful, intramuscular hemorrhage precluded during anticoagulant therapy. Intravenous route of drug administration. Applied sterile aqueous solutions permitted introduction of hypertonic solutions not more than 20 to 40 ml volume. Intravenous injection is carried out by introducing a one-time or drip method. To eliminate the toxic effects, injections of potent and toxic drugs should be carried out slowly, and before this, substances should be dissolved in solution of sodium chloride or glucose. Advantages includes immediate action, increasing dose, suitable for irritating substances used in emergency situations, ideal for high molecular weight substances. Disadvantages are unsuitable for oily substances, may result in adverse effects, must be slowly injected. Strict aseptic techniques are required, and there is a need of expert for administration of drug through IV route. Inflammation at site of injection can occur. Intra-arterial injection. For intra-arterial administration, resorted when you need to make a greater concentration of the drug, like antibiotic, anti-cancer drugs, or have an effect on the vascular wall, like introduction of vasodilators for treatment of endarterite limbs. Inhalational route Inhalational route can be given in the form of aerosols. Inhalation route is applicable for anesthetic drug, for topical use aerosols of bronchodilators, corticosteroids, and antibiotics. The depth of penetration into the respiratory tract depends on the size of the drug particles. Advantages include absorption is fast, ideal for gaseous dosage form. Doses can be titrated, effective for respiratory patients. They have less side effects, localized effect to target which is the lung. Disadvantages: addictive route as the drug can quickly enter the brain, difficult to regulate dose, and difficult to use. Most of the addictive substances in the form of powders are or insufflations, they are administered through mouth or nose in the form of aerosols or aerosol powder. Then transdermal or cutaneous patches, used to direct action on the pathological process or to obtain a reflex response of the internal organs. Therefore, drug must penetrate to a sufficient depth that determines the basis of ointments, paste, or liniments. Transdermal drugs or cutaneous patches, they are applied on the organs, they are applied on the skin. Cutaneous patches, but they releases the drug slowly and reach to the target organs, internal organs. Advantages include they bypass first pass metabolism, they bypass their destruction in the stomach and GIT contents. It is a painless process because no injection or intervention or invasion is required. They are ideal for administration of lipophilic drugs which have poor oral bioavailability, ideal for the drug that are quickly eliminated. Disadvantages: some patient allergic to patches. Drug must be highly lipophilic. Delayed delivery of drugs, limited to drugs taken in small daily doses. Medicines can also be administered. We have seen so many routes of drug administrations. Now, medicines can also be administered in the eye, intraocular, nasal passage, in the ear, and applied to the nasal and oral mucosa. So, what happens? Oral dosage form takes the longest route to reach the systemic circulation. You can see through this diagram. Intravenous route, directly the drug goes to systemic circulation. But in the case of drug, when it is taken through oral route, it goes to stomach, then to intestine, from intestine to portal circulation, then portal circulation to systemic circulation. So when we desire fast or emergency action from the drug, parenteral routes are the preferred word. Or if it is highly lipophilic, transdermal patches can be tolerated, then that is the ideal route. Respiratory route, sublingual route is also fast. Then what are the factors modifying drug dose and response? Different people in a given population may respond differently for a drug, or they may require slightly different dose of the drug. So why there is a differences of drug response and drug dose in the population? These factors are exhaustive textures. These factors we will discuss one by one. Age, body weight, body size, gender, genetic factors, pharmacogenomics and pharmacogenetics, time of administration of drug, pathological state, drug-drug interactions, immunologic factors, species and race or ethnicity, route of drug administration, psychological states, physiological states, pregnancy and lactation, tolerance and resistance, dependence, other idiosyncratic reactions, environmental factors, etc. So these factors now we will discuss one by one. Now, drug response variation can be quantitative or qualitative. Quantitative means drug response related to amount of drug reaching to plasma concentration. Qualitative related to drug concentrations at its target. According to this, the drug responses can be because of pharmacokinetic handling of the drugs, that is ADME, we have already seen. Variations in number or state of receptors, its sensitization and desensitization, coupling proteins or other components of response effectuation. Variations in the neuroendocrine regulation or tone or concentration of specific hormone or neurotransmitter. Environmental factors like type of diet we take, Drugs and metal correlation, meal correlation, exposure to insecticides, carcinogens, tobacco, alcohol, charcoal, or broiled meat, etc. Then psychological factors like patient's belief, attitude, and expectations, especially works in the CNS drug. Then placebo and nocebo effects. The placebo and nocebo effects are the psychological factors. How age works. Different patients are classed according to their age because they differ in their body surface area, they differ in their weight, or they differ in their gender categories. For example, we say the old patients who are more than 60 years, they have reduced body fat, they have reduced body weight, they have reduced renal and hepatic function, reduced perfusion rate, and they have altered physiology of the body. So, because of all these parameters, the drug may not provide the same response as it gives to the normal healthy adult person. Likewise, in the case of infant under the age of 1 year, has very little body surface area, and also there some of the organs are not totally developed. Some of the enzymes may not may be deficient in the neonates. So likewise, age can be an important factor in drug dose and also the response produced by the drug. Route of drug administration: magnesium sulfate, oral route purgation, local application on joints decrease swelling, and IV route produce CNS depression. So routes we have already said different routes will provide the different effect, and one route may not be suitable for another dosage form. For example, aspirin, which is suitable in the form of oral dosage form, may not be tolerated by the intravenous dosage form. So, to some person. So, different factors for different dosage forms and different routes of administrations, which we have already studied. Genetic factors: transporters, metabolizing enzyme, ion channels, receptors with their couplers and effectors are genetic determinants of drug response. As we have seen, the examples of G6PD deficiency cause hemolysis with Rimacune and other oxidizing drugs. Likewise, warfarin is acting slowly and carry the risk of bleeding in some patients, but may not be in some patients, especially in C by P2C9 variants. Then P glycoprotein results in tumor resistance to many cancer chemotherapeutic drugs. Physiological factors we have already seen. Now, other factors we will discuss one by one. Time of administration. At what time the drug is administered? First, the drug should be administered as prescribed by the doctors. Prescription should be strictly followed. If drug is having a time duration of 6 hours, then it should not be taken within these hours because toxicity may lead. Morning dose should not be taken in the afternoon, as this may affect. Some of the enzymes are very active during the morning because the body followed circadian rhythm. Then pathological states. Drug may not provide the proper or desired response if there is pathology involved with the patient, like kidneys failed or there is problem in the liver and there is some other pathological conditions. Then there can be drug-drug interactions. As I have told you, drugs are nowadays given in fixed dose combination, where there are two or more drugs in a single tablet or single capsule. So these drugs may interact with each other when you are taking two or more fixed dose combinations at the same time. Immunological factors: it is the immunity of the patient which may sometimes alter the response of the drug, like idiosyncratic reactions, which is the allergic reactions of the person to the drug or certain chemicals, and tolerance or sensitivity of certain drugs. So all these parameters comes under immunological factors. Then species, race, or ethnicity. I've already told you this is the pharmacogenetic factor, pharmacogenetic factors, where the traits or inherited traits of the patient can vary in a population, and so the response can vary in a population. Psychological states, you have already told. Physiological states, pregnancy and lactation. If a mother is pregnant, if a lady is pregnant, or if a lady is lactating, then the drug can cross the blood-brain barrier and can reach in the infant through placenta or can be present in the breast milk and can affect the condition of the infant. Then tolerance and resistance. People may show different sensitivity or tolerance or resistance towards a drug. That may depend upon their immunological factors, their pharmacogenetic or pharmacogenomic conditions. Some drugs carry dependence and abuse liability. But again, according to the tolerance and resistance, that dependence can be different. Like some person can tolerate higher doses of a drug and some may not. Then environmental factors, diet and all, we have already discussed. So this is the references, authenticated references, good books where you can go through to see the detailed, and you can make the note of all these topics from these books. Thank you. Have a nice day.